Well, there are growing concerns over increasing number of COVID-19 infections, particularly in the Western Cape and KwaZulu-Natal. And for the past couple of weeks, there's been a decline in daily vaccinations. This may be a contributing factor to the rise in infections in the two provinces. Let's speak to Professor Barry Schoub. He's chairman of the Ministerial Advisory Committee on COVID-19 vaccines. Prof, thanks for your time. We appreciate it. So this decline in the number of daily vaccinations, any idea why this is happening?
Yes, good evening, Sean. Well, we can really only speculate. It could be a number of reasons. I think maybe one of the main reasons is sort of a kind of an apathy. We had a lot of enthusiasm when the program started. In fact, we were really kind of bowling along very, very well. And now there seems to be some kind of slowing down. I think to some extent maybe apathy. I hope it's not too much of an anti-vaxxer kind of element, although up to now it seemed to be relatively minor. But anti-vaccination sentiment has received quite a lot of publicity, unfortunately, an inordinate amount of publicity. And we need to kind of communicate to try and address this as quickly as possible. That may be another factor. I don't think that's the major factor. I think it's really apathy. And I think we need to kind of convince people that the vaccine is so safe and so effective, and it's really going to go a long way to preventing certainly severe illness. And we've seen that there's been a major reduction in severe illness in countries which have got extensive vaccination programs.
Yeah, I know it's not your job, but does government need to do more to reassure South Africans then? Because, as you mentioned, this anti-vax narrative has gained popularity over the past couple of weeks.
Unfortunately, absolutely. When they did a survey quite recently, the anti-vaxxers, I think we've got to distinguish between anti-vaxxers, who are sort of a kind of a militant activist anti-group, often with conspiracy theories based on pseudoscience, as from the vaccine hesitant group, which I think is probably a much larger group. A recent survey put the anti-vaxxers at about 14 to 15%, and the hesitant about double or triple that number. And the hesitant, I think, are people that do ask questions. They are anxious. They want to know, is the vaccine safe? It's not going to affect me. It's not going to be long-term effects and so on. And I think we need to. It's our job as professionals. And I think it's really the job of communication professionals to get that message out there. I think what we need to do is have a cadre of what we call trusted communicators. Trusted, in other words, people that are respected and trusted in the various communities who can give the message out. And I think we need to work on this.
Yeah, there is some legitimate concern from South Africans about the vaccines, given that we do hear about, and it's a very small percentage of people still getting seriously ill, people still dying after getting the vaccine. How do you reassure them as the advisor on COVID-19 vaccines on the Ministerial Advisory Committee?
I think we need to reassure them with good scientific evidence. There are events which do occur after vaccination. We call them adverse events. But the vast majority of those adverse events are not causally related to the vaccine. They're just temporary. They just occur at that time after vaccination. And we need to get that message across. There have been very, very few serious side effects directly due to the vaccine. And that's really a few in a million doses. And that's the kind of information which must get out to people that are hesitant. And that their hesitancy needs to be addressed. It needs to be respected. They are asking justifiable questions. And we need to kind of show them the evidence why these vaccines are safe. And that all these associations, even deaths, have not been proven to be, in the vast majority of cases, due to the vaccines. Whereas on the other hand, the illness itself certainly does carry a certain mortality and severity of illness. And the vaccines are there to prevent that, the severe illness.
Are you satisfied with the number of daily jabs we are able to actually carry out in South Africa right now, or do we need to increase that?
Shahan, we need to increase that. We need to increase it substantially. We were really aiming to get by the end of August, end of this month, 300,000 jabs per day. We're now really about 176,000. So we're just over, 50% of that. We've got quite a long way to go. I think if we want to reach at least some kind of community immunity, we don't know exactly what the threshold is or the percentage of people that need to be vaccinated, but certainly what we do know is that the great majority, maybe 75, maybe 80%, we need to be vaccinated by the end of the year to get some kind of community immunity. And we need to be about 300,000 per day to get to that level, and also to have vaccination over the weekends to try and at least boost the numbers, get to that kind of target.
Why isn't that happening, though? Who's to blame? Because we have MECs for health in different provinces boasting about vaccinating 1 million people when we have a population of over 55 million.
You know, Shahan, I think provinces like Limpopo have done very well, and they're actually a shining light. They can show the other provinces a lesson. It's difficult to really pinpoint where the blame should be. I think certainly we've got a fairly secure vaccine supply. We've got a large number of vaccination sites. Maybe the communication needs to go out there. As I said earlier, I think we need to have trusted communicators out in the communities, people that kind of can really speak to the various strata of community, various structure of the population, and get that message, that appropriate message, which is culturally appropriate, which is language appropriate, out there to the people. I think we need a kind of a rejigging of that communication. Maybe that's what's lacking.
Yeah, Prof, I know you can't answer or say who's to blame, right? So let me rephrase the question. Do you think that government is doing enough to make sure that at least 300,000 people are going to be vaccinated daily in this country?
You know, to answer the question, I think the government has done a lot. I know they've come for a lot of criticism, but I'm not one that feels that that criticism is justified in many, many cases. I think what could be done by government more is that communication. That kind of multi-level of communication, I think, has to be seriously considered by government. That may be the one defect which needs to be addressed.
Communication about what? Or do they need to set up more vaccination sites and especially over the weekend get more people vaccinated?
No, I think communication to encourage people to get vaccinated, to get the message out there, because I think the message is probably not getting out there adequately. I think the main reason why there's this low vaccination is to a large extent apathy. And also that people feel, well, maybe the disease is not that serious. Maybe the vaccine can cause severe side effects. That information needs to be propagated out there. The problem is that we're dealing with a lot of social media, which is often hostile to vaccine distribution. And I think, you know, I'm not sure that that's the main reason. I think the main reason is that I think there's probably not enough knowledge about the advantages of it. You know, this is the first time in history that we've rolled out vaccine to adult populations. We've always done to children, but not to adults. So this is a learning curve. You know, I think we do need to kind of benefit from the experience of other countries which have had trusted communicators out into the community. We do need more vaccination sites, but we do have a lot of vaccination sites in the thousands. And most of them, you know, there are certain individuals that are far from vaccination sites, but I think that's the problem. I think it's in the urban areas we're having under-vaccination, more than the rural areas.
Yeah. All right. Thank you so much for your time and your insight. I do appreciate it. That was Professor Barry Schoub, Chairman of the Ministerial Advisory Committee on COVID-19 vaccines.